o'clock.
And breaking in the last hour, Governor Roy Cooper just addressed what's on everyone's mind. When can we get back to normal, and what will actually normal look like?
Well, he said our daily lives will still be impacted and for a while. But before we can reopen and get to a new normal, we have to get three things right. And here's what they are. That's testing, tracing, and trends. We'll need to increase testing so health officials can isolate new cases. Once those cases are identified, health officials will need to be able to trace who those people have been in contact with. And the state also needs to see the trends, new positive cases, hospitalizations, deaths, and available equipment heading in the right direction.
And Cooper said the virus is going to be a part of our lives until there is a vaccine, which could be more than a year away. Now, we all want to get back to work, but we have to do it in a way that won't set us right back to square one and overwhelm our hospitals.
Here's what he said you can expect when some of our restrictions do get lifted.
In our new normal, you may see more people wearing masks or having their temperature checked. A restaurant you may go into may have tables that are only partially full. The only sporting events or concerts that you may be able to watch for a while will have no in-person crowds.
When is still the big question, but the governor says because of social distancing, our hospitals have enough beds, ICU beds, and ventilators right now.
And that is very good news. And Mecklenburg County may be reversing some response plans and scaling back because of it. Let me get you caught up with where the county stands right now. To date, there have been more than 1,000 residents who have tested positive. 19 unfortunately have died. And Channel 9 government reporter Joe Bruno has been closely following the local response.
And Joe, I understand that you just obtained a letter this afternoon saying that Charlotte will not need that field hospital to handle a surge of cases.
And Damani, the good news is the field hospital that Atrium and Novant were originally expecting to be needed here at the Charlotte Convention Center is no longer needed. I was the first to break this news this afternoon on Twitter. I obtained this letter sent to County Manager Dina DiOrio saying the stay-at-home policies are working. It reads in part, "We are seeing a flattening of the curve, resulting in a continued decline in peak hospital census projections. Instead of positive cases doubling every 2.85 days as they were previously, the current trajectory is showing positive cases now doubling every 6 days. The letter warns if social distancing is eased prematurely without supporting data, this trend could reverse. If that happens, Atrium and Novant say the Charlotte Convention Center would be a good option for a mass care site. Congressman and Dr. Greg Murphy says Mecklenburg County residents should be encouraged by the letter.
We're learning from data. We're learning from real-time experience. We're not, running around that the sky is falling, and that we're able to plan appropriately and do things in real time.
If needed, Atrium and Novant say they have created additional capacity in their hospital systems to accommodate an extra 600 beds. Damani.
Well, that is good that they will have that room to accommodate patients if needed. Joe Bruno reporting live for us tonight. And in the last 10 minutes, Mecklenburg County is recommending everyone wear cloth masks when you go to the store or anywhere else where it is hard to social distance. Now, this lines up with the CDC's recommendations from earlier this month.
For weeks, we've been told it would likely take 18 months to develop a vaccine. But now, the National Institute of Health's lead scientist for coronavirus vaccine research says it could be ready for use by emergency workers as soon as this fall and ready for the global population by next spring. She says her team has actually been working on a coronavirus vaccine for years already. North Carolina saw nearly 100 new cases just today. Right now, there are more than 5,100 cases in the state. 117 people have died. Mecklenburg County has the highest number of cases in the state. The state has performed nearly 68,000 tests. South Carolina saw a slight drop in new cases today. It announced 105 new cases today, down from 127 from yesterday. But the state is now reporting more than 100 deaths with more than 3,600 cases. The state has completed nearly 35,000 tests. Now to a concerning issue that's really been growing by the day. The wave of cases happening inside local nursing homes.
Channel 9 now confirms there are 96 cases in one nursing home alone in Salisbury. That is absolutely right. We said 96 cases. Take a look at this map here. There are now outbreaks in nursing homes in Burke, Cleveland, Cabarrus, Rowan, Union counties, and you can see at least 4 outbreaks in Mecklenburg County. Let's bring in now Channel 9's Mark Becker, who joins us live now. And Mark, we don't know where those outbreaks are in Mecklenburg County, but because the county isn't releasing that information, you've been looking into that today.
Yeah, some people asking that question, right, Damani? There are, as you say, a handful of facilities here. They're called residential care facilities in Mecklenburg County that do have at least 2 cases of coronavirus confirmed. The only one we know by name is the Pavilion here in Ballantyne, and that's only because management here confirmed those cases to us. But Mecklenburg County's public health director says there's a good reason they're not letting everyone know.
He's not doing good. He's very confused. He's in a lot of pain.
Catherine Ardrey can't stop worrying about her father, Glenn Blaisdell. After he moved into the Citadel nursing home in Myers Park, they called to tell her that one of their residents had tested positive for the coronavirus. But she hasn't heard if they've had any more since. Would you like to know?
I would love, yeah, I mean, he's my dad. I mean, now I grew up, he was my hero.
Management at the Citadel confirmed that one positive case to us, and we've since learned of another positive case at Sharon Towers in South Charlotte. The only facility we know of with an outbreak of coronavirus, that is 2 or more cases, is the Pavilion here in Ballantyne, where management confirmed to us they had 3 cases. But we do know it's not the only one.
So to date, we have had, I believe it's 6 outbreaks, in long-term care facilities.
Yesterday, the county's health director, Gibby Harris, wouldn't name those other facilities because she said the Pavilion and the others with outbreaks have managed to keep the spread of the virus to a minimum. A handful of residents at most.
If we were to have a large outbreak where we may have more concern about that, we might very well release that name. But at this point, if we released an outbreak, we're releasing the address of individuals, and that's not typically what we do in public health.
Between the lines here, I think there's another concern as well. As long as the facilities like this one are managing those numbers very well, and they appear to be, the health director and the health department feel that if they release information and names, that people might overreact, that there might be some real fears raised, and perhaps, Damani, even panic, and they certainly don't want that if it's not warranted.
And definitely no one wants that. Mark Becker reporting live tonight in South Charlotte. Thank you. Well, we're seeing cases grow in other nursing homes dramatically. The number of confirmed cases has now doubled to 42 in the last week at Grace Heights Health and Rehabilitation Center in Morganton. 29 of those positive cases are residents and the rest are workers. Earlier today, Burke County reported its 5th COVID-19 death. Now, we don't know if any of those deaths are linked to the nursing home.
We do have some good news tonight. Stimulus checks are starting to show up in some people's bank accounts. We know a lot of you have really been waiting on that money, and we also know you still have some questions. So let's bring in Action 9's Jason Stujanki for us this evening to weigh in. Jason?
Oh yeah, Allison, people are so pleasantly surprised. You know, I've met so many people throughout this pandemic. We've stayed in touch. They've been messaging me and emailing me, sharing their concerns and fears with me along this journey. And then all of a sudden this morning, like you said, good news to report. All of a sudden I started getting all of these messages, people telling me that their stimulus money popped into their account. And so you could see just the emotion level change. It was really nice to see what a difference a few hours make, at least for now.
And even though we have seen a lot of people really pleased and happy now that they've seen that money come in, some people have a lot of questions too because they're saying they didn't get the money they expected.
Yeah, we are getting obviously a lot of questions, a lot of concerns, and actually the second half of today they started to really flow into my inbox. If I really break down the questions people are having into 3 categories, the most common ones seem to be, like the one you mentioned, that something's wrong with the dollar figure, the math is off. They thought they were getting more money than what they actually ended up with. Number 2 is, you know, that IRS website tool that you can track your money. Well, a lot of folks are having problems accessing that. We actually went on there ourselves just to see how it was going, and honestly, I wasn't able to get through it all either. It said, please wait because of the high demand. And then the third one we're getting, this one sounds so narrow, but I'll tell you, Allison, this is coming up a lot. People who use tax preparers to help them with their taxes, it's complicated the system in a way that they're afraid their stimulus checks are going to go to the banks that those companies use instead of going to their banks. So we're sorting that out as well. So Allison, coming up in just a little bit at 6 o'clock, we'll take a deeper dive into all of those issues and most importantly, direct people, tell them where they need to go if they have any question involving the stimulus money.
Well, we know you're always looking out for all of us, Jason. Thanks. We'll see you at 6 o'clock. We all owe so much to our healthcare workers. They are continuously fighting to save lives, and they're risking their own, too.
We keep seeing these parades by local first responders paying tribute to our medical community, and they've been incredibly moving to watch. You know, tonight, Channel 9's Gina Esposito takes us to Huntersville to watch another tremendous show of support.
Whether it was said out loud or in a hand gesture, the Parade of Lights was a way for first responders in North Mecklenburg to show their support for our healthcare workers.
Well, we just want to make sure that our healthcare, and we're calling them healthcare heroes, men and women, the doctors, the nurses, the hospital staff, we want them to know that we appreciate their endless hard work they've been doing for weeks.
It's great for us to be able to go out there and, show our appreciation and just, show that we're all in this together.
Along the parade route that stretched from Huntersville to Cornelius, people showed up with their families to wave, cheer, and share the experience with others.
I'm here to support our community.
We followed the parade from Chopper 9 Sky Zoom. Patrol cars, ambulances, and fire trucks visited Novant Health and Atrium Health facilities. And while many staff members couldn't come outside to see it themselves, I'm told they appreciated the visit.
It's just been great. I mean, the outpouring of support from the community, from the first responders to the local restaurants to even just the local neighborhoods bringing us donations of food and just everything. It's just been wonderful. It's actually very touching.
In total, the parade traveled to 4 different medical facilities and it lasted about an hour. It was just incredible to see how many people came out to support our healthcare workers. Back to you.